Hi, everyone. Welcome to my YouTube channel. It's all about the respiratory therapy. And in today's lecture, we're going to start with fundamentals of respiratory therapy. Firstly, don't forget to subscribe my channel and hit the bell icon. You don't have to take screenshots of each slide. Just go to my Instagram from the link in description below and DM me the title of topic you need slides of, Introduction to Respiratory Therapy. Respiratory therapy is a specialized healthcare field focused on the diagnosis, treatment, and management of patients with respiratory disorders. It involves the use of advanced medical technology to support lung function and improve breathing. And a thing to note that respiratory therapy is not just related to the respiratory system, it's an important part of the medical sciences and in overall patient care. It involves many other systems and things to be monitored and managed along the respiratory one. History of respiratory therapy. The concept of respiratory care dates back to ancient times when people used herbal remedies and manual ventilation techniques. In the 18th century, physicians experimented with oxygen therapy for treating lung diseases. 1920s, discovery of oxygen's therapeutic benefits led to early oxygen therapy. 1940s to 1950s, introduction of positive pressure ventilation and iron lungs for polio patients. 1960s, establishment of formal respiratory therapy education programs. 1970s to 1990s, advancements in mechanical ventilation and blood gas analysis. 2000s present development of non-invasive ventilation, NIV, high-flow oxygen therapy, and advanced life support techniques. Scope of practice in respiratory therapy. Respiratory therapists, RTs, play a critical role in diagnosing, treating, and managing patients with respiratory diseases. Their scope of practice includes assessment and diagnosis, evaluating patients with lung conditions using physical exams and diagnostic tests, performing pulmonary function tests, PFTs, to assess lung capacity, analyzing arterial blood gases, ABGs, to determine oxygen and carbon dioxide levels, oxygen therapy, administering and managing supplemental oxygen therapy, setting up and monitoring oxygen delivery systems, such as nasal cannulas, masks, and oxygen concentrators, airway management, performing endotracheal intubation in emergency situations, managing tracheostomy care for long-term ventilated patients, mechanical ventilation, operating and managing ventilators for critically ill patients, adjusting ventilation settings based on patient response and ABG analysis, non-invasive ventilation, NIV, using BiPAP and CPAP therapy for patients with conditions like COPD and sleep apnea, preventing intubation in cases of acute respiratory failure, aerosol and medication therapy, administering bronchodilators, corticosteroids, and mucolytics via nebulizers or metered-dose inhalers, educating patients on proper inhaler techniques, pulmonary rehabilitation, helping patients with chronic respiratory diseases improve lung function through breathing exercises and education, assisting in smoking cessation programs, critical and emergency care, participating in life-saving procedures such as cardiopulmonary resuscitation, CPR, assisting in trauma and emergency departments for acute respiratory distress, sleep medicine and home care, conducting sleep studies to diagnose conditions like obstructive sleep apnea, providing home-based care for patients requiring long-term oxygen therapy or ventilatory support, role of respiratory therapist in patient care, in intensive care units, ICU, managing ventilators for critically ill patients, monitoring vital signs and ABG results. These are not the only things respiratory therapists do in ICU, but these are explained in scope before. In emergency and trauma care, assisting in airway management and intubation, providing immediate oxygen and breathing support during medical emergencies. In general wards and clinics, conducting pulmonary assessments and spirometry tests, administering breathing treatments to hospitalized patients. In neonatal and pediatric care, assisting premature babies with underdeveloped lungs, managing neonatal ventilators and surfactant therapy. In home and long-term care, educating patients and caregivers on the use of oxygen therapy equipment, monitoring chronic respiratory disease management in home settings. We will study all these care in depth in further lectures ahead. Respiratory therapy is a vital healthcare profession that plays a crucial role in managing respiratory diseases across all healthcare settings. Respiratory therapists work alongside doctors and nurses to improve patient outcomes, ensuring effective breathing support and life-saving interventions. Thank you. See you guys in the next lecture.